So, Dr. Takeuchi, tell me a little bit about yourself.
Okay, I've been specializing in infertility for 35 years. In 1989, I went to the US to study the in vitro fertilization program in Norfolk at Jones Institute, which is famous for being the place uh, where the first IVF baby in the US was born. I studied preimplantation genetic diagnosis there for 3 years and won the US Fertility Society Award 2 times, both in 1991 and 1992. In 1992, I came back to Japan and started an infertility clinic, specializing in IVF preimplantation diagnosis.
Great, thank you. What is the history of your hospital?
Okay. I'm a fourth generation doctor. My great grandfather started in 1904. My father was an OB/GYN doctor as well.
So, what new procedures have you been involved in creating?
We were the first clinic in Kyushu in Japan to specialize in IVF and preimplantation genetic diagnosis procedure. We also have created the preimplantation genetic diagnosis and NGS, so-called next generation sequencing, on the cell's embryo to check on the embryo's chromosomes, including Down syndrome and other genetic diagnoses. I have published a paper that outlines an original procedure that establishes a protocol for IVF for women who are advanced maternal age.
What makes your hospital special?
Okay. Our success rate is excellent and has been ranked in the top 10 clinics in Japan, especially for advanced maternity aged women over 40, where the total overall success rate is over 50%. If we apply preimplantation diagnosis, then the rate is over 80%.
Tell us a little bit about your international experience and your experience with international patients.
Okay. I attend international conferences around the world every year and often make presentations out there. I often meet leaders in the field of IVF at these conferences. One of these leaders was a legendary Professor Gianroli in Italy. After attending these conferences, I then bring what I learned and the newest techniques and information back to my institute.
How can you make a difference in your patients' lives?
I like children, and I'm happy to be able to help women get children of their own.
By the way, what are the estimated costs for an IVF treatment at your institute?
Okay, costs run from about 700,000 to 800,000, which at the current exchange rate of 143 yen to the dollars would come to about $4,900 to $5,600.
What is the timeline for the procedure?
Okay. It takes about 2 weeks in Kagoshima, then 1 week of relaxing, maybe even traveling, then return to Kagoshima to finish up to the procedure with transfer of the embryo to the uterus. So a total of about 3 weeks.
So tell me, why is your clinic a good environment for the IVF
Okay.
procedure?
My clinic is ranked as one of the best in Japan. We use the latest techniques and procedures. Our institute has the highest quality instrument and our operating rooms are very sterile and the climate control is very stable. We also tailor the procedures according to the individual patient. And Kagoshima is a beautiful place with good water, good quality air, and a warm climate that makes for a healthy and happy place.